Okay. Hi, AP Psych friends! This is our very first screencast. As you can hear from the music, it's St. Patrick's Day. We are going to make this fun. We're going to have some information for you.
Yeah. And
we don't know what we're doing.
No.
So
we'll get better as we go.
Yeah.
We love you.
We love you. Hang in there.
And keep studying, read your textbooks.
And go Tigers.
Go.
So we just figured out how to embed a video, and we're going to periodically throw some of these fun little Snapchat pictures in with us. We are getting so techie, aren't we, Lobby?
We totally are.
All right, we haven't even started any hardcore content, but that's okay.
Tried to do this 6 feet apart. Okay, so we've been talking about anxiety disorders, we've been talking about depressive disorders, we've just got done with schizophrenia, and now we're going to be in this module talking about a lot of other disorders that are very, very interesting. You can see our learning targets right here, and we may or may not be able to only have one, what is it, Lon, called? One video for this module. We may have to have two, but we'll just do the best we can.
Yes, we'll get as far as we can. I think it's only going to be about 10 minutes long, and then there might be a part 2 or a part 3. We'll see.
All right, so this first one that we're starting with is a really interesting one, maybe one that you've never heard about before. It's called somatic symptom disorder. And so this is when you have a physical ailment of some kind, and so but it's something that's actually not a physical ailment. It's something that is more psychological in nature. So the formal definition is it's a psychological disorder in which the symptoms take a somatic or a bodily form without apparent physical cause. This could be, like it says below, vomiting, dizziness, difficulty swallowing. People actually think that they have a physical disorder. So they'll go to the doctor, for example, but the doctor can find nothing physically wrong with them because it's actually a psychological disorder. It's something that's in their head.
All right, so underneath somatic symptom disorder, we're going to talk about 2 specific disorders that fall underneath it. And the first one is called conversion disorder. It's when a person experiences a very specific type of physical symptoms that are not compatible with recognized medical or neurological conditions. So a patient with this disorder will have some kind of physiological function that doesn't make any sense when a person or a doctor does a neurological exam. And so they may not be able to walk, they may not be able to talk, they may have some kind of unexplained paralysis, and they're neurological symptoms. But again, the key is that the person goes to the doctor, and the doctor runs a variety of exams, a neurological exam, and they can't find anything wrong. So what they realize is that it's not a physical situation, it's a psychological situation. So there was some kind of stressor or trauma that the person experienced that transferred into some kind of neurological symptom.
All right, this next slide talks about illness anxiety disorder. And so now we're getting even kind of more specific into a subcategory. And this is one, if you've ever known somebody who's just always a little bit sick, they always are talking about a stomach ache or a headache, and then not only do they feel a little bit sick, they sometimes think that this physical ailment is potentially like a sign of cancer, or they have, their appendix needs to come out, or something to the extreme. And this is kind of indicative of illness anxiety disorder, which is a disorder in which a person interprets just normal physical sensations as symptoms of a disease. They kind of, go straight to worst case scenario. And you can tell where it is anxiety, because that anxiety makes them think worst case scenario in this case. So on the bottom there, you can see that they're interpreting these normal sensations as possibly being something extreme. And so, but it does say sympathy or temporary relief from everyday demands may reinforce such complaints. They like that attention potentially that they're getting from having those symptoms.
So you'll see on this slide, as well as the previous slide, that there are video links that if we were in class, talking about these disorders with you live, we would just play the video. But the app that we're using to create these screencasts doesn't allow for us to do that. So you're going to notice that we're going to have some play posits for you to open and work through in addition to watching these screencasts, but that will just come within our Schoology instruction. All right, so we thought we'd be cool and